This video is going to cover a single arch dentate edentulous. I put that on there because the patient just has a few teeth. Guided smile, implant direct surgery. So just a maxillary arch. And the reason I call it a dentate edentulous is because the pin guide, right, the initial guide is going to sit on a lot of tissue. And that is meaningful. And we'll go through that. But first, the bite. All right, this is a pretty tricky bite. Now, maybe if this was a digital scan, perhaps the scanner might have picked this and oriented. But these are analog models, which is perfectly fine. But for establishing the bite, we need something. And of course, we need something to establish tooth position, right, in the maxilla, because we don't want to guess. Now, we have a lot of lower teeth. You can set this case up for a traditional overjet, overbite, one-to-one relationship, but it is kind of nice to get something in the mouth. And that's what doctor did. Doctor ordered bite blocks and did a little bit of wax molding, gave us a midline, and you can see the midline is not the same as the lower, right? So the patient is a little bit asymmetrical here with tooth loss. So we got that, scanned it in, and then we're ready for articulation planning and everything, because now we have a good bite. Always trust a nice bite block. All right, so then we meet online, we go through the whole deal, getting the case ready for surgery, fabricate, send, and then as always, we're going to use the SurgiMat as our guide for getting through the surgery. All right, here we go. So there was the flipper that the patient had, but did not like and did not fit very well. So that comes out, and then the pin guide is going to sit on the teeth in the posterior here with a window, and then all of this is on tissue. All right, so that's where the little bit of a difference with a fully edentulous, where this is a scan appliance and the scan appliance is in the shape of the denture, or where it's fully dentate or dentate supported, where this is securely fastened, seated on teeth. This is a combo. And in this situation, it could be, the team, the staff could put a lot of pressure on this area here when holding the pin guide in and compress the tissue too much, which throws off the bite. So right here, this is where you want to do the 2-finger technique. Have the assistant put index finger here, thumb here, something like that, and just put not too much pressure. Hard to use scientific words with pressure with fingers, right? But you don't want to stand behind the patient and force this apically, because it is going to move the anterior part of it. It's going to teeter. So just hold it firmly. The 2-finger technique, as Dr. Hamill says, use the 2-finger technique. Hold it firmly while you're going through the drilling. And then you'll see on the SurgiMat the pins A, B, C, D, right? That way you can see the anatomy underneath. This is edentulous where the pins are going, so really no issues there. And there are obviously no extractions prior to pinning. And then you'll look at the SurgiMat in this view to see the length of the pins. In here, they're all short, A, B, C, D. All right, so use those 2 windows to determine the position of the pins, and then long or short. All right, on the SurgiMat, which is on the wall. All right, now pin guide is seated. It's confirmed that it's seating on these teeth. The assistant's gonna hold it in. Okay, the plan is set, all good. So then it's removed, and now a crestal incision will be made, because we want some lingual tissue to support the pin guide. So make a crestal incision here. The pin guide, now maybe this could have been a little bit more labial, so that we have a little bit more support of the pin guide. But then the pin guide is brought back in, and obviously not an exact image. This is not bloody here, but Then the pin guide is brought back in, held as we talked about, pinned, fixated, and in a maxilla like this, narrow, short, definitely want to stop the pin short and then tap them in with a surgical mallet. See, this is short. That should be tapped in. You have to be careful. It's edentulous, but those two posterior teeth should hold it in place, but then tap these flush to get it very secure. All right, and then at this point, you can look at the SurgiMat. You can make sure that your guide is floating in the right position, right? That you have a gap here, just like on the SurgiMat. And then you want to take the bone down flush with the top of the fixation base, as always. And you can see the volume of bone that needs to be reduced in the image. All right, so this has already been leveled. Looks good. Then you try in the carrier guide. Carrier guide, make sure that this helps you make sure that you have reduced enough bone so that it passively seats. If the carrier guide is wobbling or won't go into the chrome locks, it's because there is tissue, which this could be sutured, stitched back. It's either tissue or bone, pretty much one or the other. Right? Now the SurgiMat part has been placed on the counter, maybe the night before, in the morning, whichever, and the implants, abutments, and temp cylinders are all laid out for a grab and go. All right, so the team can have that all prepared, ready for the surgery. Then osteotomy guide goes in. Follow the drill sequence. It's going to tell you the drill depth. This is a pretty simple kit to work with. And then you follow the drill sequence from either the drill report that we can provide, since we're using these OEM sleeves, or just follow your normal drill sequence from your book, from your instruction booklet. But Implant Direct is a pretty simple way to follow, to follow the sequence. Now, this is the original kit. This is the keyed spoon kit. They have a new keyless kit, quite easy to use as well. All right, so this will give you the implant size and it'll give you the overall depth. All right, go through the process, drill your sites. Looks good. Put the implants in, put the abutments on, seat the carrier guide, and then place your temp cylinders. And then here, this image here, you can see confirm that the temp cylinders are in the correct trajectories. All right, looks good. Looks like the planning was followed really well with orientation. And doctor did a nice job. So these are all straights, 1, 2, 3, 4 straights. And then these two are angled back here, right? You can see the little nubs for the indexing. So doctor really did a nice job, right? This is almost exactly the same as the SurgiMat on these two posteriors. All right, then next step is to seat the prosthesis, make sure it's passively seating. You can see maybe this implant was rotated a little too much, and so you're close to the wall here. This one's perfect, the rest are perfect. Take it out, seat the gaskets, reseat the prosthesis, put in the little blue plugs, backfill with Stellar, hit it with a light, go back in the lab and finish this prosthesis. Should take 10, 15 minutes. There's videos on the website to show you how fast it is. Team can do it, staff can do it, and then voila, deliver. Beautiful prosthesis. All right, so that's GuidedSMILE with a little bit different type of pin guide. Thank you.